For my research paper, I decided to do manual therapy in the treatment of scars. And for this, basically, there's very conflicting evidence, whether it's massage therapy, manual therapy, or mechanical therapy, anything along those lines. It's very positive. There's a lot of research that says it's very good, but there's also a lot of research that kind of shows against it. So overall, the research is very inconclusive with regards to that. So just to give you guys a little bit of an introduction, scarring typically occurs from burns or surgery, and it leads to a mark on the skin that usually is due to a wound, burned, or sore that is not properly healed. As a result, this can place a huge burden on a lot of individuals, and actually in the US, it's over 500,000 people that are affected from burns specifically, and get associated scars with that. The next aspect we need to quickly discuss is the natural healing process. So this typically occurs in 3 stages. That's inflammation, proliferation, and maturation. And the last phase, maturation, is typically when the scar tissue is in the phase of developing, of continuing to grow, of improving its pliability. And what's really important during this phase is we're still not sure yet if the effects of manual therapy and treatment of manual therapy can improve the speed of this maturation phase. So that's still what we need to figure out, and the research is yet to point in a specific direction towards that. But that's kind of where certain research articles are hinting at future areas of research. There are 2 main types of scars. The first one is hypertrophic and the second one is keloids. For hypertrophic, these are typically composed of type 3 collagen fibers, and keloids are typically composed of type 1 and type 3 collagen fibers, and they can actually be separated into 2 groups, minor and major, and the major ones are usually greater than 0.5 centimeters in height. Now with that said, the research doesn't point in one specific direction in the treatment, manual treatment towards one of these specific scars versus the other. So I'm going to focus on the global treatment of scars, manual therapy wise, and what we can do for that. So with all that said, what does the research say? So in the first article that I'm going to be talking about, it's by Zanier et al., and it basically was an article about how to properly manage scars for healthcare professionals. So they looked at this kind of the psychological aspect, and they also looked at the manual therapy and manual aspect. So for the manual therapy side of things, they looked at massage, they looked at cupping therapy, and they looked at a couple more, but I'm primarily going to focus on those. For massage, they found that there was no conclusive evidence to suggest that massage is very helpful with the treatment of scars. Overall, in terms of massage therapy, there still needs to be further research in order for them to conclusively be able to come to a conclusion for the effectiveness of it. Theoretically speaking, in another study, it actually talked about how massage therapy should have an effect, and through breaking up the fibrotic tissue of the scar, it should be able to increase the pliability of the scar and ultimately be able to help the individual out. And in regards to this study and talking about other manual therapy techniques, it was talking about cupping therapy, like I said, and just other things like friction massage, and ultimately they weren't able to come to a specific conclusion. Everything was inconclusive, all the other forms of therapy, and as a result, those forms of therapy are not currently recommended. More research needs to be done. Another study basically compared 2 forms of scarring massage treatment, and they compared it in a pediatric burn group, and basically one group was given a general protocol in which they were just massaged in a circle for about 5 minutes versus another group that was massaged between 5 to 25 minutes using 10 different exercises, standardized protocol, and they ultimately came to the conclusion that, believe it or not, between those 2 groups, there was no conclusive evidence to suggest one group was better than the other, but they did find that the 2 groups had significant benefits when it came to vascularity and itch. And another study which basically focused on the non-surgical methods for hypertrophic scars, and specifically that type. It basically, on a global picture, it basically talked about using various scales like the McGill pain scale, I believe it's called, the visual analog scale, on all these different types of scales. They were able to show both long-term and short-term that there were increases and better yet, benefits and improvements with regards to mood, anxiety, depression, and a variety of other factors for the massage scar group. In another completely different study, which focused on the care centers and the rehabilitation centers in France, they looked more anecdotally speaking at all of these treatment teams and basically what they are doing for the treatments of specifically of burns and the treatment of scars for burned individuals. And what they do is they kind of have this protocol where in the first month they focus a lot on lymphatic drainage and hydration, and then in the next month they move on to hydration and crushing exercises, and then they eventually move on to like more rolled pleat stuff, and that's their overall protocol they use. Now the other thing with these France teams, rehabilitation teams, is that when a scar becomes inflamed, 80% of the teams either reduced or completely eliminated their massage, the use of their massage for scars. Now the other thing is that they had, for adhesions and contractures, both, they had these specific protocols in which they used a variety of different tools. Now another thing is some authors within this paper reported that as a therapist, it's really important to understand the proper depth and intensity to manage for different individuals according to the appropriate inflammation associated with their scar. For me personally, I see this study as being very beneficial for the scar research, and I found it to be very interesting just because it's not like typical research articles. This is something where it's very anecdotal, but I think it's something that's very important to compare because these are specialists treating these burns versus something that's very more scientifically based, and I just think it can be very beneficial for the literature long term. Just the last paper that I want to touch on is called The Role of Massage in Scar Management, and it was basically a literature review where it talked about both burn patients and post-operative patients, and these patients were getting scars associated with that. So the general picture and message from this is that the research is inconclusive with regards to massage and the treatment of these scars. On just under 50% of the people in all of these literature reviews that they looked at were actually being benefited, and the rest were not seeing any improvement at all. Now the important takeaway message as well is that there was 30 people that were post-operative scarring, and of those 30 people, 27 people showed improvement. So it does seem like, based on the research, there is more effectiveness towards post-operative people versus other elements such as burns. Overall speaking, an issue with the current literature is the fact that there is substantial variability with regards to frequency, duration, how long after the injury, as well as the specific technique that's used for scar treatment. However, it does appear that massage is the most widely known and seen in literature, but even massage is not even conclusively shown to help in the treatment of scar tissue, and all these other methods that I talked about throughout the paper in this talk, none of them actually show proper scientific validation to show their effectiveness. So anecdotally speaking, it's important to note that there has been a lot of people have noted a lot of effectiveness and benefits towards massage and other manual techniques. However, further research needs to be done in order to conclusively say